Hello and thank you for joining this edition of the One Young World Speaker Series. My name is Solomon Elliott and I'm a proud One Young World Ambassador, having attended the Hague and London summits in 2018 and 2019. I'm the founder of The Student View. We're a media literacy charity working to create a newsroom in every school and ensure all young people become confident and creative media consumers and creators. I'm thrilled to be speaking with longtime councillor Antonio Zappulla, the CEO of the Thomson Reuters Foundation, the philanthropic arm of the world's largest news and information provider. And in the wake of COVID-19, we're here today to discuss misinformation in the age of pandemic. Thank you for joining, Antonio. As we just said, I last saw you in October. Times have changed very quickly since then. But I know you are from Italy, and I'd like to know more about just how your family are doing.
Thank you, Solomon. It's good to be connecting again. My family is doing fine, and I guess as fine as you can in these circumstances. They haven't left home in, it's coming to 3 weeks now. My family members, especially my parents, are really right at the top of the high risk category because of underlying health conditions and because of their age. So they really haven't left the house, and they're trying not to. The good thing is that there is no food shortages in Italy, so the system is actually around them is actually working in a way better than it's actually working here in London. There is no issue in getting food deliveries. There is no issue in getting the type of food that they need. So far so good, but obviously, as you can imagine, immense psychological pressures and fear. Really, I mean that's the best word to use. I guess it's a fear of not only what's happening right now, but I guess. For people of their age is the fear of what's going to be happening after. The upcoming figures for GDP projections for the next quarter in Italy are -8%. So they're looking ahead and they're looking at what the long-term consequences for the country will be. Thanks for asking.
No problem. I'm glad to hear that they're okay. My thoughts and prayers are with your family. We've sourced a number of questions from One Young World ambassadors across the globe, so I'm going to kind of fire them at you. And the first is from Zoe, who's from Greece, and her question was, what can be done to dispel or disprove misinformation around COVID-19?
First of all, I want to highlight two words in this question. The first one is misinformation, and the second one is COVID-19. And why am I doing that? Because 3 weeks ago, if we would have spoken about misinformation, we would have used the word misinformation in the context of anything really that was perhaps the US elections or anything that had to do with climate change, anything really that was polarizing. And now suddenly misinformation is becoming a health issue. And I think that's a really, really interesting twist. The challenges effectively remain the same. And so if you want, from a news production point of view, it means quality. It means journalism with a capital J. It means, the journalism that has a mission to inform society, journalism as a craft. And then from a consumer point of view, I guess it's all down to fact checking. And I'll get there in a minute. But I think what's really interesting for me to see is that there is an incredible amount of misinformation out there. And you must have seen yourself the one about, taking a bath or, holding your breath for 10 seconds to kind of identify whether you have caught the virus or are immune to it. There is even people talking about having to gargle with bleach. I mean, there's a lot of misinformation out there. This time it's not going to swing the vote. It's going to determine whether people stay alive or not. And so that's why it's so crucial. When it comes to the profession itself, I was referring to two aspects here. There's one about the craft of the profession, and there's one around the consuming aspect. The first one, I guess, when it comes to the profession itself, it's really challenging because this is the biggest story. This is the biggest news event really in a generation, and it's being reported 24/7. And suddenly you find journalists that are finding themselves really thrown into this news cycle, even without having the right skills and competences. So it's really, really challenging from a journalist perspective. You need guidelines, you need guidance, quite frankly, and there is a total lack of coordinated approach, both when it comes to the medical response, but also when it comes to what's happening on the ground. And also there's a total lack of information flow. This is not being coordinated right now. So this is really, really challenging. And I guess, from a consumer point of view, it's really all about the same. It's about basic fact checking. And what I mean with that is that when you read something, you need to stop, you need to think, you need to investigate, you need to find more coverage, you really need to identify new claims and cross-reference. Now, today we are launching a new initiative at the Thomson Reuters Foundation, which is the coronavirus reporting hub for journalists in the Global South. What we're trying to do with this network, we really want to start, first of all, from Africa. So we'll identify a cohort of 15 journalists across Africa, English-speaking Africa for now, and we really want to connect them, A, with other journalists who have been reporting the crisis in countries where this has hit the hardest. So we're going to be connecting them with journalists from Italy, from South Korea, from China, to ensure that they can learn from the lessons of other professionals. We're also going to be connecting them with healthcare professionals around the world. We're going to be filtering, gathering, and distributing to them a daily newsletter with the most authoritative information that's out there on a daily basis. And also we're going to be giving them skills that they desperately need right now, from crisis reporting to fact checking to data analysis to data visualization. So now really is the time to create global coordination and solidarity mechanisms. Long-winded question I answer, but I hope you answer. Whatever, you got the point.
No, absolutely, and plenty to think through there. And congratulations on mobilizing so quickly in response to COVID-19. Do you think there are any kind of examples of best practice that you've seen within newsrooms who have tackled this information pandemic successfully? Who's doing a good job?
I think Reuters is definitely doing a good job. That's not because it's our company, but because we're doing a good job in emergencies for hundreds of years. And also because it's really seen as a trusted source of information. There's multiple levels at which you can cover the story. There is the global level, so the global pandemic, the global response, but also there is a very, very local level. So, you know, we as a global news organization, I think, can do what we can do to a certain extent. The Thomson Reuters Foundation obviously has a specific news desk, which is really dedicated at really looking at how vulnerable communities are faring across the world. And so we are adapting our content to really highlighting the multiple implications for people, for society, and for human rights when it comes to COVID, because you have multiple issues at stake here. You have a really steep rise in surveillance techniques, for example, around the world. People are now being monitored through the data of their mobile phones. Now, are these measures going to last once the crisis is over? And who determines when the emergency is over? So there's a huge data and technology piece here. There are also unintended consequences. We are seeing a spike in domestic violence because people are staying at home. So there's so many intertwined issues here that we are covering on a daily basis. But beyond what we are doing, I think there's tons of courageous journalists that have been reporting this on a local level, and they're really trying to make sense of this huge mess in their local context. And I think that's really the journalism that's heroic here, because it's really filling a massive void when it comes to the information gap.
Absolutely, but it's again quite sad in the sense that local media is being disrupted massively because of advertising revenues, and similar to the financial crisis of 2008, it's likely that local journalism will be even more on its knees than it was previously. So that's going to be really kind of interesting to see how that develops over time. Our third question is from Hiro in Japan, and it's this: with a rising death toll in places like Italy, how can we educate people whilst preventing harmful practices such as panic buying? And how can we inform the public without eliciting indifference or fear?
Look, I guess the media has a key role to play here, right? So in the key role to play here, it's to investigate, but also to hold power to account. And let me give you an example. Here in the UK, we had restrictive measures for, I think, 3 days. On the day those measures were introduced, one of the most respected news bulletins in the country, which is BBC News at 10, had reporters suddenly discussing the striking similarities between the Italian curve and the UK curve of infection. And they finally came to the realization that the curve was identical, because in Italy we had 233 people dying after the first death, which was on March the 7th, exactly 15 days after the first death. And in the UK, the curve moved exactly the same way. So March The 21st, we had exactly the same total, and it was exactly 15 days after the first death. Now, what that's suggesting is that effectively the UK is 14 days behind Italy. Now, the curve had been around and available to study for a number of days, if not weeks. What was striking for me is that nothing like that was discussed until the lockdown had come into place. And I would have personally expected more pressure on government on why the government is not moving fast enough. Now, that's in a UK context. Now, I'm not saying that the BBC did a bad job, but I'm just saying the role of the media is to pass and share accurate information at this time, because millions of lives are depending on information at this specific moment in time, but also to hold power to account. Now, the question was, how do you educate people without preventing harmful practices? It's by telling the truth. It's by telling people that food shortages are not an issue, and by making the message clear. And that's where the government's role is crucial. The message has to be clear. If the message is stay at home, you must have to stress that you're staying at home. Going for a walk, going down the park is sending a mixed message, because you're telling me that I can go to the park, and then can I stay at home or can I go to the park? So I guess that's where the media has to step up pressure. What exactly are the guidelines of a specific government in any given circumstances? Are we staying at home or are we not staying at home? It's as simple as that.
So clear messaging. Absolutely. The next question comes to us from Costa Rica, and it's from Isabel. And the question is, to people who don't know where to access information from, what news sources would you suggest they access?
Well, first of all, you need to understand what the news source is, I guess, and the technology companies are also helping. They've been helping in the past couple of months. They identify even the ownership of a specific news source, and then I would just say the first source here is really the scientific community, because as impartial as the media wants to be, there's often a tendency to lean towards a specific political color. But scientists that really have no political colors, and that's the beauty of science. So I would definitely go for scientific sources. The WHO is doing a fantastic job, and they even have a WhatsApp group and Bolt, which if you just text 1, 2, or 3, they actually send you accurate information in real time. So that's one of the sources that I'm personally using myself. Then I guess you really should question what you consume and what you use. And it's not particularly difficult to identify the most reputable sources of information in your country. If you don't trust the government, or if you don't trust the media in your country because it's subject to models of ownership which make you question the validity of that information, then go straight to the WHO. In this context, you have a very valid source of information at the top, and that's where I would go.
Thank you. And in terms of practical steps, how do you think people can distinguish accurate information from inaccurate information? What kind of 3 tips would you share with people listening in they can take away?
Cross-reference as much as you can, and it's not as complicated. It's actually much easier than what it sounds. If you read something that you think it's odd, look, I'll give you an example. Yesterday on social media, on WhatsApp, I received a message from 3 friends and family member in Italy, which was showcasing a documentary that aired in 2015 on the Italian media that was talking about a virus made in a lab in China out of a bat, and then injected in a rat, and that would have actually created some sort of coronavirus that would link to deadly lung failure. So I started, obviously Googling the information. I couldn't find this anywhere. The footage was there. So this was a real documentary that actually aired on state-owned TV on Rai in 2015. But suddenly what I started seeing, and that's actually what the Italian media is doing really well, on the front page of Repubblica, which is one of the most respected Italian newspapers, the main and the top story was that this video that had been circulating virally in the past couple of hours on WhatsApp was actually referring to something that had nothing to do. And the article was so well written. It had quotes from the scientific community. It was actually even explaining why that experiment had been taking place from the very beginning. So it's fantastic to see that the actual media is looking at this issue because it's actually hampering the efforts of what they are trying to do. Another good example is, again, coming from the Italian media, which I'm watching for obvious reasons very often these days, is that at the end of the main bulletin, which in Italy is at 8 p.m. as opposed to 10 p.m. here in the UK, they have a whole section where they actually debunk misinformation that they've been finding on the internet and across social media channels during the day. That's very effective. I guess it takes two. It takes, from a consumer again perspective, making the effort in researching what you are reading, how striking and how compelling it might sound, and there's a role for the media, and also there is a role, I guess, also for politicians. I mean, when you might be mindful of the language that you're using. I mean, if you use hyperbolic language and you elicit fear, if you talk about the virus as a Chinese virus or an Asian virus, that's really spreading panic, and that's irresponsible. And that's how it has to be called for what it is. And also really ensuring again that you're not facilitating panic and fear. I mean, a lot of conversation around potential drugs being used for as antiretroviral in HIV or malaria prevention. You know, that's completely unfounded right now. You know, these drugs are being really developed and adapted. So being very, very careful, especially if you hold the role of authority in what kind of messaging you're putting out there.
Absolutely. So it's just about, being very responsible with your language and going to authoritative sources. Interestingly, in the UK, the BBC now has a disinformation reporter, which is a big development. And, during the Brexit referendum, that wouldn't have been around, or in previous political contests. It would be very interesting to see how technology companies adapt to misinformation in future elections, and will they adopt the same practices that they have with COVID-19? We're running out of time, unfortunately, but I've got one more question for you. And this comes from Oni from Namibia. And it's this: when shock value is often used successfully by the media to attract viewers and readers, how do we discourage this tactic in times like this?
Well, I guess, again, it goes back to the responsibility of news owners, and the temptation there to use imagery that provokes panic. It's there, but this is not a new issue. I mean, if you think of any, from 9/11 being the perfect example, a lot of news outlets decided single-handedly that they would ban the footage of the planes crashing in the towers, for example, and that's been now considered as ethical standards going forward. Nobody who's writing anything about 9/11 now refers to that footage. If you're referring to catastrophe, natural disasters from Haiti to the Philippines, it's often making sure that there are ethical standards for imagery, which Reuters, for example, have been spearheading for a number of years now. But I guess it's about the tone, it's about the language. I mean, everybody is on edge. The role of the media is to calm people down and to give factual information. It's not to exacerbate fears. But that goes down to the responsibility, if you want, the ethical standards of business owners, because eventually media is a business, and it's a role of the editors, but it's also the role of the owners. And so it's at this moment in time, I think it's important to stress that if you are running a media company, you are really running a company which is providing information that is actually affecting the lives of millions of people at this precise moment in time. So be careful with how you handle your business.
Absolutely. A really, really powerful message there, Antonio. Thank you so much for your time. A huge thank you. We've got one final ask of you, which was if you could leave the One Young World community with any advice, what would it be?
Stay home.
Nice and short. 2 words. There you go. Thank you for watching. Take care. Stay indoors, as you said, and make sure you wash your hands.
Thank you.
See you later.
See you later.
Bye.